recording to the media immediately following. We thank everyone for their patience. All right. And Amelia, if you can hear me, we have Vicky now. All right. My name is Adanis Marin, and I'm the coordinator of the Raise the Bar campaign. And I think that it's not a secret that we have been going through a tremendous pandemic here in Rhode Island and across the nation. But there are some things that have made it worse in Rhode Island, and we believe that there is urgent action that needs to be taken. It is a matter of record that Rhode Island is the only state in New England without a minimum staffing standard in nursing homes, and only one of 11 in the country. What that means is that you could be a nursing home resident today, and you have no guarantee of care. You could go 24 hours without receiving any care while you're in a nursing home, and we believe that that is unacceptable. And we are seeing the consequences of not having safe staffing regulation in our state, and these consequences are tragic. Rhode Island ranks 42nd in the country, 42nd in the country in terms of how few staffing hours are received by residents in our care and our nursing homes. Since the pandemic has started, 75% of all COVID deaths in Rhode Island have been related to nursing homes. That is one of the highest in the country. And when we add in congregate settings, such as assisted living, it goes up to 81%. This is not an act of God. This is a result of us not having the protections that our residents need, and our nursing home workers not having the tools that they need in order to take care of our residents in the best possible way. The CDC has affirmed over and over again that there is a direct connection between infections and the level of staffing in nursing homes. In the months leading up to the COVID crisis, we monitored and tracked over 100 short staffing complaints that were filed with the state. And invariably, almost every single one of those found deficiencies. It's not good enough to look at the record 2 or 3 years ago when there wasn't this strenuous and focused attention to deficiencies in the nursing homes. We need to look at what was happening just a few months before this crisis started, and you will find hundreds of complaints that were filed with the state about short staffing and unsafe conditions for our nursing home residents. Meanwhile, the nursing home industry in Rhode Island has made over $241 million in the last 2 years, and that's according to their own cost reports. These are not small businesses. These are multi-million dollar businesses. If you're a small business person, when you're making $10 million, then I'm not sure what it takes for you to be a big business. But our industry has profited while not having enough staff to provide the care that residents deserve and need. And just in the last couple of months during the crisis, it turns out that the industry has received over $50 million new dollars, over $50 million new dollars in funding. It's impossible to cry about poverty when already there is $241 million in net profit. But starting April 1st, retroactively, there was a 10% increase in nursing home Medicaid fees for service in the Medicaid rate in all of our nursing homes, a 10% increase. Additionally, on May 2nd, $13.6 million in state funding through the Workforce Stabilization Program was made available to nursing home owners in order to pass that on to workers. May 22nd, the U.S. Health and Human Services announced a $4.9 billion funding stimulus to nursing homes. Every single nursing home in our state received $50,000 in free cash. Additionally, they received $2,500 for every single bed that they were licensed for. Understand that's for full beds or empty beds, $2,500. So a nursing home with 100 beds would have gotten $50,000 from HHS just for existing, and an additional $250,000 in free money additionally. So when we hear the industry say that there's not enough money, we just have to look at the facts. They're all available. And what we see is that while we have been going through a crisis, the nursing home industry has profited first $241 million over the last 2 years, according to their own reports. And just in the last couple of months, they've received an additional $50 million. And we as a coalition are here to say that that money is public money. The majority of funding for nursing homes comes from Medicaid and Medicare, and the public has a right to demand that we get good quality care in return. And we have a right to say, if you're going to make millions of dollars, then there are things that you have to do to take care of our residents that you are entrusted with. You know, when we started this campaign, there were a lot of people who didn't realize how bad the nursing home situation in Rhode Island was and the staffing situation. But a recent survey shows that now 82% of Rhode Islanders, that's regardless of party, regardless of age, 82% support our bill for 4.1 hours of resident care. They support our bill that does three things. It implements safe staffing with 4.1 hours of resident care guaranteed to every single nursing home resident, which is the federal recommendation. It provides that we have funding to recruit and retain quality caregivers in our nursing homes. And thirdly, it establishes a training fund so that whenever there is a crisis like this, there is already an apparatus, a way for nursing home workers to get the latest, most up-to-date training so that they can do what they need to do to provide and take care of our nursing home residents. One of the reasons why we're holding this press conference today is because we know that there is a rumor that the Assembly is planning to end the current session soon. And the sad fact is we cannot let the status quo stand. There are too many deaths now in Rhode Island. There are too many people who have suffered. And we need to send a message that throughout this crisis, nursing home workers have reported to work, and they have stayed and worked their shift, and many have stayed overtime. And nursing home workers do not leave until every single resident that they are assigned to is taken care of. They are called heroes over and over again, and it is time for us to do what heroes need. It's not enough for us just to say that nursing home workers are heroes. It's time for us to give them the tools that they need in order to take care of the residents that they care for and that they love, and that is their responsibility and their calling. And today we are saying that just like nursing home workers are heroes who don't go home until they get the job done and they take care of all their residents, we're calling on our legislators to please don't go home. Don't leave the status quo in effect. Please stay until we get the job done for our residents. This is something that is common sense that we urgently need. The status quo is literally costing us lives, and we've had enough tragedy. It's time for us to do something so that we can turn things around. First, we're going to hear from a couple of nursing home workers, and then we're going to hear from Senator Mary Ellen Goodwin and Representative Scott Slater, who are both sponsors of the proposed bill. And first, I would like to call on Jean Austin, who is a registered nurse at Genesis Greenville Skilled Nursing Center. Jean, you'll need to take off your own mute.
Hello. Can you hear me?
Yes, Jean, go ahead.
Can you hear me? Because I was having a problem with my audio.
We can
Okay,
hear you.
perfect. Hi, Scott. I'd like to introduce myself. My name is Jean Austin. I'm a registered nurse, and I have been a nurse for over 50 years, 30 of which have been in the long-term care industry. I work at the Greenville Center, and over the past several years, I'll give you a little background. Over the past several years, the nursing home industry has been plagued with the fact that patients are leaving the hospital much sicker and much quicker. And they are, and of course it is putting a demand on the staff. The staffing has been totally inadequate. We have CNAs who have been working with long hours. They have an assignment of anywhere from 10 to 12 patients apiece. The quality of care, because these patients are sicker, has diminished over the course of years. The wages have been poor. Some of these CNAs are only working, they're making less than $15 an hour. And, you know, they're not making a living wage. They are working double shifts. They are working in more than one facility. They go from one facility to the next just to make ends meet. So we're looking to improve the quality of care for our patients in the nursing homes. Then along comes COVID, which has placed many more demands on the facility and the employees. It has significantly reduced the number of people that we have caring for patients because the employees are getting sick as well as the patients themselves. They're overstaffed, they're emotionally distraught, their wages are low, they're going from one facility to the next just to try to make ends meet. And from an infection control standpoint, you can see where the COVID infection has spread throughout the nursing home industry. It has, I think that the whole COVID pandemic has served to validate the fact that we are so understaffed and so underpaid. And therefore, we are really looking for help. And the reason for my being here is to ask you to help us through the passage of the Nursing Home Quality Care Act, which will help the increase staffing levels and also increase wages so that our employees do not have to be so stressed and working multiple jobs, etc. So I appreciate the time you have given me to speak with you, and we need your help, and I hope you can help us. Thank you.
Thank you, Jean. And just before we introduce our next nursing home worker, one of the statistics that has recently come out that I think people need to know is that during this crisis, over 500 nursing home workers contracted COVID. And this is something that they went to work and they took care of their residents and they had to risk bringing it home to their families. But they did their job because they care about their residents and it's because it's what they signed up for. But they signed up for being able to do the job the best way possible, and that takes having enough staff to do that. In addition to the 500 positive tests, there were over 200 who were presumed COVID positive, but were not able to get testing in time. And I'm sad to say that there were 4 deaths from nursing home workers, including one death at the home that Jean works at. Nursing home workers that gave their lives for their residents. Next, I would like to call on Victoria Mitchell. And Victoria is a CNA at Hopkins Manor. Vicky, you're going to have to turn off your on mute.
Yeah,
There you go.
can you hear me? You can hear
Yes,
me?
you're good to go, Vicky.
Hi, everybody. My name is Victoria Mitchell. I work at Hopkins Manor for 24 years plus. As you guys know, we always campaign about the safe starving bill. And we had problem already before this crisis, the epidemic. Nursing homes were shut. People are working on a condition like piecework, as I said it all the time. We take care of human beings. We don't take care of machines. We rush through a room to room to give these people care. We even forget to pee sometimes. And people, the patients are suffering. The residents are the one that get in there. We get it too. But our old people, our old sick people are suffering through this because nobody want to listen. Everybody just think the job is something you can go in, anybody can do it. For example, this crisis made me think, wow, we were so short. One day, we were 3 on my unit with 44 patients. 3 CNA with 44 patients. I took out my coworker, I said, we gotta do this, we're here. That's why we signed up for. We signed up for that. And we worked from room to room. Then breakfast truck came out. We have to pass the breakfast. I always say that it's not only giving care. They have to go to the bathroom in between. Just close your eyes and picture your loved one in there, want to pee, but they patiently waiting for you because they understand you shut. Do you want that for your loved one? No. We need to do something. We need to change this. We're giving our life, we're going every day. Our members, our CNA, our nurses are getting positive in the nursing home. We go for 14 days. Some of them get better. Some of them come by, they get a second positive, they stay coming back. They care for the resident. So our representative, senators, they need to pass this bill. They need to pass the bill because we need it. They saw people were out sick. They saw the nursing home was shut. Before we were shut, but now it was worse. Then we become undertaker for them. Nobody could enter the nursing home. CNA have to beg their own resident. With their resident died, we beg them. We put a tie on that. You know how emotional that is? But we're doing the job because they couldn't come us there. Other people stay home to work. We don't stay 6 feet away from our patients. We do direct care. We feed them. We give them fluid between this time for them to get hydrated to fight the corona. It's what they call care. And it reached a point now, people have to understand, we're not gonna sit around, we're all fighting. We're gonna fight as a CNA to get our nursing home employees to get paid the right amount and get the training and get everything. So I'm asking my senators, my representatives to please pass this bill. Thank you.
Thank you, Vicky. You know, I think that when we hear these stories from our caretakers in nursing homes, it's important for us to remember what they have been through. They have gone to work not knowing whether or not they would be bringing home this infection to their families. They have taken care of residents that they have known for years. They have been the only social contact with these residents. They have been understaffed and unable to provide the care that they would like to care. Having to go from room to room and knowing that sometimes they wouldn't have enough time to get back to a patient before they passed, but still doing the job because knowing that they were the ones that the residents were counting on. Not knowing what they're bringing home, crying before work, crying during work, crying after work. As Vicky said, putting residents who they have grown to love into body bags. This is what our nursing home workers have had to go through. And so it is because of that that we are asking the legislature to stay and get the job done for residents also. We know that nursing home workers are heroes, and we've heard that from our elected officials. And it's time for us to so really call on our elected officials to please do what it takes to make sure that these heroes get what they need so that they can do what they need to do. Next, it's my honor to call on one of the co-sponsors of the bill, someone who's been a champion for nursing home workers. We will now hear from, I'm sorry, we're going to be taking questions immediately after our state senator and state rep speak. And right now, again, I'd like to call on one of our champions, State Senator Mary Ellen Goodwin.
Hi, folks. Am I unmuted? Can you hear me?
You're good.
Okay, great. I mean, it's really very hard for me to follow the testimony that we just heard. I mean, I just want to say, folks, that early on, when I met with the leaders of SEIU back in the fall at a Dunkin' Donuts, and they proposed this legislation as an idea, I told them then I would fully commit to this bill. I saw the necessity of it, you know, and I really didn't understand fully just how low the care was here in the state of Rhode Island. And I wondered out loud to myself, and I do now, how many families and residents in these long-term care facilities actually realize in a 24-hour period that their loved ones don't even get 4.1 hours of direct care. I didn't know that myself. Those statistics are staggering. Back in February, I think we had a big rally at the State House before this pandemic started. And I said it then, and I'll say it again today. This is my top legislative priority for this year. Before the pandemic, it was my top legislative priority. And now we really must, you know, raise awareness to this legislation moving forward at every opportunity we have. Just because tonight the legislature will recess or adjourn does not mean that this bill cannot come to fruition this year. We will be back sometime in July, it's my understanding. And how we get this bill done remains to be seen at this point in time. If it could be included into our state budget, I mean, that probably would be an optimum case. But if we can pass it as a standalone bill, that would be great too. I know my colleagues in the Senate remain committed to this bill. It has overwhelming support in the Rhode Island State Senate. Now will be up to me and Representative Slater to figure out the mechanics on how we actually see this bill to fruition. I just want to tell everyone here, especially to the caregivers in the state of Rhode Island who have done a yeoman's job. There is no way that we can ever repay you or thank you with any kind of salary. But thank you from the bottom of my heart on behalf of so many Rhode Islanders for the care and the heroic job you've done during this pandemic. And lastly, I just want to leave you with this, that seniors here in the state of Rhode Island really are our state treasures. Not only do we love them, but they help build this country, they help build this state, and they're really a link to our past. They deserve better. And certainly the caregivers deserve better. So again, I'll just say I remain 100% committed. I'm going to give it everything I have to see that this bill passes this legislative session. And I'll be happy to answer any questions at the appropriate time. Thank you for your time, folks.
Thank you very much, Senator. And again, we'll be taking questions at the end. Next, I would like to call on Representative Scott Slater, another champion for this bill and for nursing home residents and for nursing home caretakers. After him, we'll be talking about an action that's coming up very soon while the press prepares their questions. Representative Slater, you're good to go.
Thank you so much. I just want to say thank you to everyone who's involved in this movement and in this press conference today. Jean, Vicky, Victoria, thank you for your time and your service to many of our residents. Your work definitely doesn't go unnoticed. Sometimes you might feel like it's going unrewarded with how we haven't been able to pass this bill, but I appreciate you and I see you and I thank you for all your service and everyone else that's been, and to my colleague, Senator Goodwin, thank you for all your hard work on a regular. It's always been great to partner with you on issues. As Mary Ellen said, early on when I met with the organizers at SEIU, they had approached me about this bill, and it's been my #1 priority, and it was something I actually asked to be the sponsor of a piece of legislation that I felt very important about. So at our last press conference, when I talked, I mentioned my mom a little, and I'm going to try not to get into it because unfortunately my mom passed since all this. But what I want to say is to Vicky, I don't have to close my eyes because I've been through it for over 2 years. I've been through it. She was in assisted living when she passed. Thank God for so many of the workers over there that were amazing, but she was isolated due to this COVID. But I will tell you, she was in and out of nursing homes because of different falls and different incidents that she had. And going from the hospital, like Jean said, the hospital stays very short. I remember one time when I had her at the hospital and they basically told me that her medical wasn't paying anymore and that we needed to find something to do. And they were ready to put her out in the front with their bags to go home. So I've lived this for 2 years in and out of nursing home facilities. The workers are amazing, but as Vicky said, I'd go in there some days and there'd be only like 2 CNAs for a whole lot of patients. And I remember one incident, and I really never talked about this too much because my mother's a proud woman, and I didn't want to bring up incidents that happened with her while she was still here, and I didn't want her. She was always nervous about different things, but I remember one time when she was in there, the workers were so amazing, they were so good to her, but they put her on a commode one day, and the poor CNA that was there was so short-staffed and so that my mom had to stay. She said, I can stay, I need to stay a little longer on this. Can you leave me? And she said, well, I got to get to another patient. And she said, oh, don't worry, I'll be fine. And unfortunately, she walked out and my mom fell while she was at that facility, right? And you know what my mom's biggest concern was that CNA. She didn't want to say anything. She didn't want to report anything because she knew she got such a relationship with the direct care worker that was working with her that she was afraid something would happen to her. So the struggle's real, and I've been living with it for a while. So that's why this bill is personal and extremely important to me, because I saw those workers on a daily basis, and I saw what they were going through, and I saw when they were understaffed, and I saw what they had to deal with multiple patients. So how could you ever be mad at someone that's just caring for your relative and doing the best that they can under the circumstances that they're given? It's a shame that we don't have any standards in the state right now. It's something that we need to do. 4.1 care hours is a very small amount to ask for your loved ones. As Vicky had mentioned, think about your loved ones and close your eyes and envision that. Well, I don't have to, because I've been through different stints, and I've been there on a daily basis, and I've dealt with different issues. And, my mom passed, and she received, I don't want to say she received great care at the assisted living that was over there, but the isolation and the loneliness, and those workers were scared as well. They were scared on a daily basis, and probably not always given the best, working under the best of conditions. So I understand, and it affects me personally, and I'm urging my colleagues, and I'm going to fight to get this done. And as Mary Ellen said, it's not over. We still have the 2021 budget. Right now, we're passing a supplemental budget. We're going to be coming back in July. And I think it's important to get some sort of language and standards included in that. And I'm going to continue to fight for that, and fight for all the CNAs that not only I met over the years, but the CNAs that are working on a daily basis in all our nursing homes, all our congregate care settings. You guys are heroes, and not due to this COVID. You've always been heroes. You've been there on a regular basis. This COVID infection is just something that amplified the issue and made your jobs 1,000% harder, which isn't fair. But I thank you all. You guys have been angels for many of us and for many of our family members. And the only way I can think to reward so many of the wonderful direct care staff is by getting this bill passed and urging my colleagues and fighting and continuing this fight. It's something that I won't give up on. It's also my #1 legislative priority, and I'm going to continue to talk about it, and especially in my mother's memory and honor. It's something that I'd love to see get passed, and so other folks that are in her situation and in and out of nursing homes and congregate care settings, that they get the proper care and the proper attention that they're needed, and that the workers that are working there can work and function in a manner where they can provide the proper care and not be stressed out, constantly worried about even going to the bathroom on their own. It's just not fair to everyone involved. So for the families, for the workers, I'm fighting for this bill, and it's more important than ever. And it was important at the beginning of the year before COVID. And it's something that I'm going to continue to fight and talk to my colleagues on, and bring more of my personal experience to them and advocate for them to push for this. And you guys, the organizers, have been doing an amazing job. I will tell you that. Don't think that your phone calls and the work that you've done. I hear from so many of my colleagues on a regular basis that even yesterday, I had a couple people came up to me and they said, how can we get this done? I need to work with you. We need to meet. And I got phone calls from my constituents, from people that work in congregate care settings and nursing homes. And so thank you for your work and your advocacy. It's been amazing.
Thank you very much, Representative Slater. And I know that I share with all nursing home caretakers and residents and families our appreciation to both you and to Senator Goodwin. And we know that you all are fighting the good fight, and we're trying to do everything that we can to help make that fight possible. Here on this call, and again, we're going to take questions in just a few minutes. I want to recognize some of our coalition partners who have joined us. We're joined by the Rhode Island Organizing Project today, by Tina Peterson with RAMP. We're joined by the Rhode Island Interfaith Coalition to End Poverty, the Protect Our Healthcare Coalition, and the Rhode Island Coalition Against Domestic Violence. The State Rep Slater mentioned the amount of community support and advocacy. We reviewed the numbers today, and in the course of this campaign, over 3,000 phone calls have been delivered directly to legislators. Over 5,000 individual emails have been sent to legislators. And, we believe that there's an awful lot of support for this, and that it's really going to be urgent for us to keep the pressure on for our residents and their families and for their caretakers, and that we have to keep going. We're going to take questions again in just a moment. First, I want to go ahead and announce publicly that while we have been trying to avoid the risk involved with gatherings, healthcare workers have communicated to us that they feel that this issue is strong enough and important enough for the safety of the residents and for their lives and for their families that we're actually going to be holding a rally in front of the State House this Tuesday at 4 p.m. We will be practicing social distancing. We will have PPE and mask available for participants, but a very large number of nursing home workers are going to come out to demonstrate how urgently they need our legislators to get the job done. And I know that a lot of community is planning to come, and we would like to invite anyone who supports this legislation and who is healthy enough to please join us. And keep in mind that we are going to be keeping social distancing, so we will be 6 feet apart from each other, and we will have masks available. So right now, I know that there are probably members of the press who have questions. What I would ask is if you can use the chat function in Zoom so that I know which names to unmute. And as you prepare to do that, what we'll do is when someone puts in chat or raises their hand electronically through the Zoom function, we will call on you to ask your question, and I will unmute whoever it is who you would like to answer your question. So again, if there are any members of the press who have questions, please use the chat box now to let us know. Okay, first we have Amanda Milkovich, and you should be unmuted now.
Okay, hey, thank you so much for taking my question. I just have a few here.
I'm sorry, Amanda, can you just identify which media you're with?
Sure, I'm with the Boston Globe.
Thank you.
To get an idea of how short-staffed the nursing homes are, is there, first of all, is there any estimate on how many CNAs or nurses will need to be hired to make up for it? And second of all, how many complaints were logged during the pandemic about care or short staffing or emergency short staffing during the pandemic?
Okay, I can take both of those. First, in terms of the complaints, as I said, there were well over 100 complaints that were logged before COVID started that the state investigated, and they found the majority of those to be sustained. And I believe that those are part of the public record. And they were across nursing homes all across the state. I will say that there are nursing homes that before the pandemic were doing a very good job. In fact, it's almost a quarter of nursing homes in Rhode Island that do have close to or around 4.1 hours of care. So it's not something that is not possible. And those homes have been very profitable. After the beginning of the pandemic, there was a request from the Department of Health for us to be able to give them, frankly, some breathing room so that they could focus on getting PPE and regulations and other things. And so there was a slowdown in the reporting. But I think it really says mountains about the fact that before the pandemic even started, that there were literally hundreds of complaints that were filed. In terms of how how many new CNAs our nurses would need to be hired. I think we need to do a little bit of math on that, but what we are able to see is that 4.1 hours creates a ratio of roughly 8 residents for every CNA. It's much fewer nurses that are needed in order to guarantee those hours. And we know that there are lots of people, and we can look at the registry, who are certified to be CNAs and nurses, but who have left the field. And they've left the field because they are paid, frankly, poverty wages. And they are asked to do work that is almost impossible to do. And I'm going to be calling on Jean for just a second. Jean, if you can go ahead and unmute yourself to talk a little bit about how you've seen CNAs and RNs and other caretakers leave the field because of the staffing crisis. Jean, if you'll unmute yourself, you should be able to talk now. All right, Jean, you're good. Jean? All right, I'll go to, oh, there you go, Jean. Sorry, I'm gonna go to Vicky instead. All right, Vicky, can you talk to us a little about over the years how you've seen CNAs and RNs leave the field because of the short staffing crisis and conditions?
Yeah, we one of Hopkins was one of the nursing home that trained CCRI students for CNA. They come in, the young CNA, they come in and they get the job. And they work, when they start the work, they tell you, say, what? They pay you this money for this type of job? And they quit. They would get hired, we train them, after orientation, they will quit. Nurses quit and cry and walk out because they work too much. It's too much work. They put it on the nurses, and they you have to pass medication, you got to do all your charting, you got one nurse with a med tech on a 40 some more unit. One RN or LPN or med tech. And CNAs, if you get 5 on a 40 unit, you're happy. Before the epidemic was short. Now, CNA has more short because nobody doing the job. Because it don't pay. It's a hard mental, physically, mentally work. You mentally stressed, your body hurts when you have to dress somebody that weighs 250 pounds, cannot move their hands. That's what we do. And people will not do it for a little bit of money and they walk out. They don't want to do the job. A Target paying the young kids or paying people $14, $13 and CNA getting 13, not under 15. You think they would, for $1 different, they will go be cleaning feces? Let's be real now. That's it. Nurses go to the hospital, they get 3, 4 patients. They quit, they go to the group home, they work. Nursing home has been too heavy. They gave you too many patients.
Thank you, Vicky. I also want to point out that there will certainly be a need to hire more staff in order to provide the sufficient staffing. But I think when we look at the fact that they made $241 million in net profit over the last 2 years, according to their own cost reports, and the fact that they have made $50 million again in the last 2 months, we believe that it is quite reasonable for those of us that pay our taxes, which is what funds the nursing homes, to demand the quality care and the safe staffing in exchange. Just for everyone, we will be sending out a release afterwards that has citations for all of the statistics that we are reporting. Lynn Arditi with NPR has asked, why is Rhode Island the only state without safe staffing legislation, and how have you verified that statement? So first of all, we are the only state in New England without safe staffing regulations. And we can verify that because every single state in New England, it's a matter of public record, has staffing regulations. Not only that, but we're only one of 11 states in the whole country that has no guarantee of staffing, no regulations in place through legislation or through rules that guarantee staffing. And again, that's a matter of public record. And there are many, many sources which we have provided in the past and we can provide again. In terms of why Rhode Island is the only state without safe staffing in New England, the truth is it doesn't have to be this way. There are those who would make it appear as if this is some new radical idea that nursing home residents should be guaranteed an amount of care in exchange for the millions of dollars in profit that the industry makes. But just a little over 10 years ago, the law of the land in Rhode Island was that there was staffing regulations. And the industry lobbied to remove those regulations. And I won't speak as to why past administrations allowed that to happen, but we now are seeing the tragic results of those regulations being removed. And we are fighting so that we can get just the bare minimum federal regulations in place now. You know, I think you'd have to ask others why 10 years ago or more they supported removing regulations that we already had in place. But I believe that when deregulation happens, it doesn't take too long, sadly, for us to see what the end results are of that. Okay, I don't see other questions in the chat, and I don't see other hands raised. So if that is all, I want to again thank Nurse Jean for joining us, CNA Vicky for joining us, State Senator Mary Ellen Goodwin for joining us and being a champion, State Rep Scott Slater for joining us and being a champion. And we hope to see everyone on Tuesday in front of the State House. And we really need to have the message be clear. Nursing home workers have been heroes and don't go home till they take care of every single one of their residents. And we need our legislators to have that same commitment and to stay till we get this done. Thank you, everyone. If you are a member of the press and received a press advisory about this, then you will receive a recording of the entire Zoom within the next hour. And that recording will have speakers on full screen. Thank you very much.